Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lillie Shockney.
Hi, this is Lillie Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. In this podcast, I am joined by Dr. Kerry Stewart, a professor of medicine at the Johns Hopkins School of Medicine, to discuss the best exercise to promote heart health. So welcome, Dr. Stewart, and thank you so much for joining us today.
Thank you for having me.
So our topic is going to focus on how does exercise promote heart health? And I want to begin by asking you, what type of exercise is best to promote heart health?
There's a ton of literature supporting exercise for heart health. The two major types of exercise that are recommended in guidelines that come from all of the professional organizations that are involved in preventing heart disease and diabetes also, which is, I would say, is part of cardiometabolic health, as well as governmental agencies like the CDC and NIH have recommended that people do about 150 minutes a week of exercise, which can take many forms. It could be walking, cycling, swimming, exercises like that, but should also include a component of resistance or weight training, because that helps to improve the muscles, to make better use of oxygen as work is being done and exercise is work. And that ties into reducing the burden on the heart when you do exercise. So the heart is not having to work as hard during exercise, which allows people to go on for a longer period of time. And that those are the two major types of exercise for heart health.
So I suspect our listeners are going, wow, 150 minutes. How many minutes at one given period of time is best to do? Is there a minimum number of minutes to do in a row to make sure that we do add up to 150? But I can picture people saying, I think I'll do 5 minutes a gazillion times.
Right. And so when the guidelines were first published, it's based on a lot of research at the time, but that has also evolved. And even though the recommendation is to try to do 30 minutes at a time, 5 times a week, that can be broken down also. So if you can do 10 minutes 3 times a day, or even 5 minutes 6 times a day, that adds up to about 30 minutes a day. And that would all count towards that 150 minutes. And there's also a lot of literature suggesting that just being active and not being a couch potato is also very helpful. So the less sedentary you are, the better. And even if it means just getting up and taking a short walk for 2 or 3 minutes, that also contributes to heart health.
That's good to hear, because I think that people oftentimes assume, well, I've got to buy a gym membership and I've got to go every day and I don't have time or money to fit this into my schedule. So whatever that we can do outside of a gym and in our home or walking around our block or going to a shopping mall and leaving your credit cards at home is probably more than adequate. We just assume that exercise is connected to a gym membership. I saw a t-shirt the other day that said, I'm allergic to exercise. I thought, oh my. And it was a rather large gentleman that was wearing it. And I thought, well, I don't know if he's allergic, but I know he's not doing it. That's for sure. He was a hefty fellow. Can you describe to me what is the difference between a low intensity and a high intensity exercise? You mentioned using weights.
Intensity refers to how hard are you working? How much effort are you putting in? So low intensity, by definition, would be lower effort during exercise versus high intensity, where you're working much, much harder. And in some exercise programs, they even push people to their maximum level, at least for short periods of time. So it's a matter of degree. Now, the evidence would suggest that for most people, a moderate level not only produces health benefits, but it also will increase cardiovascular fitness. And I think it's important to make a distinction between the two types of benefits that accrue from exercise. One benefit is you become more fit, which has to do with your ability to perform. How fast can you run? Or in a sport, how far can you throw a ball? Whereas the other major benefit that comes from exercise, independent of fitness, are the health benefits. Things like lowering the blood pressure, controlling blood glucose, controlling lipid levels, reducing inflammation. Those are all health benefits that can accrue even from lower levels of exercise. As a general comment, what I'll say is that to increase your level of fitness, you generally have to work a little harder. To get the health benefits, you generally can work at a low to moderate level that's within a comfort range for most people. Exercise also requires that someone do more than they usually do to get those benefits. So that you do have to put in some effort, but the amount of effort to achieve health is more in the moderate range.
If someone's been a couch potato for quite a while and now they've been inspired to do exercise, are there any tests or anything they should be doing prior to getting underway? Like, should they see their PCP and get an EKG, or is there anything just to make sure that they're not going to get out there and power walk and fall over?
Sure, that's a great question. And the old rule of thumb was that everyone should see their doctor, get approval before you do something. Well, that kind of thinking has largely gone out the window. And that if someone is obviously sedentary, but otherwise healthy and doesn't have any major comorbidities, doesn't have diabetes, doesn't have heart disease, then they don't really need exercise testing, at least to start a moderate level program. So the message to those individuals, just get out and walk, would be a great way to start. But if someone does have a history of health problems, like I mentioned, things like diabetes or known hypertension, or have had a heart problem, then they should get a checkup, which may or may not include an exercise stress test, but at least get clearance to make sure that when you start a moderate level program or higher, that there are no major health concerns. There's always a risk of exercise causing a health problem, but it's actually pretty low. But it's a good idea for someone who has known health conditions to at least get a physical.
Do you have special recommendations based on age groups? Let's say someone who's 20 to 40 versus 40 to 60 versus a senior citizen?
Not particularly. Again, if someone is generally healthy and free of major comorbidities, which could occur at any age, then age is really not a limitation. You could start exercising at any age. Now, older people often have problems with their joints, their back, obesity, although that occurs also in younger people. So they may have to start more slowly or pick an exercise that avoids aggravating a pre-existing knee problem, for example. But age by itself really isn't a concern.
I'm a believer in starting little and growing into big, so that people don't think that tomorrow I'm going to start exercising, so I've got to do 150 minutes over the next 7 days. But instead, let's do 30 minutes this week. Next week, let's bump that up to 60 minutes, incrementally increase so that it doesn't look overwhelming or not doable. Because I think people kind of throw the towel in if they think that the goal line is too far away or in their mind unrealistic.
Human nature is that people want instant results. But the advice that I give people is exactly what you said. Well, you've been on the couch for 10 years. Don't expect to get fit in 10 days. More like 3, 4, 5, 6 months. That's really the goal. That's an important goal to get across to people, although it's a hard goal for people to live with because it's New Year's. I made this resolution. I got a new gym membership. I'm going to go 7 days a week. And then by week 2, they've already quit because the benefits of exercise are not yet obvious.
Yeah.
And again, when someone starts exercise, it's going to be a little bit uncomfortable because in order to get improvement from exercise, like I said earlier, you have to push yourself a little harder than what you usually do. So when people push themselves a little harder, their breathing increases, their heart rate goes up a little, they may sweat a little. A lot of people have never really sweat much. And when they start sweating, they don't even know how it should feel. To me, that's good feedback that you're doing some work. Or even having some fatigue after a 15-minute walk should give you satisfaction that you completed it. And fatigue is normal. It'll get less and less over time. And usually when we do studies, we generally don't bring people back into our laboratory to see what has changed for about 3 or 4 months. It takes
that makes sense.
That long to really start not only feeling the benefits, but also the ability to measure the benefits when we bring people into a laboratory, either for an exercise test or to measure their blood pressure or do blood work, we usually wait 3 to 4 months before we expect to see significant changes that can make a difference, not only in someone's fitness, but in their quality of life.
I'm an avid believer in the buddy system. If someone needs to be motivated, it might not be that they can motivate themselves. It might be that their best friend who lives 4 doors down, who also wants to get out and do some power walking and exercise, might be best for both of them, so that they're reminding one another, say, hey, come on, it's time for us to go on our walk. Oh, I don't feel like, oh, come on. Once you get out there, we'll both be fine. Let's talk about the weather. Let's talk about our grandchildren or whatever it is that's going to keep them together and doing that walk together. Because I've learned that when people have to rely solely on themselves, they will let themselves down and it becomes a self-fulfilling prophecy. Well, I didn't do it yesterday. I really don't feel like doing it today either, so I won't. The momentum goes away.
I'll give you an example of practice what you preach. So what you just preached is what I have done for the last 30 something years with not 4 houses away, but right next door. Someone who happens to be, I always say he's quite older than me, but it's only by 2 months. But we've been exercising together for 32 years or so that I think I've been in this house. And
wow.
We do it through rain, sun, snow, sleet, not hurricanes, and we push each other. When I don't feel like doing it, he'll call me and say, come on, let's go, or vice versa. It helps to be either an individual or a group.
I like that. I like that a lot. Many of our listeners have children and grandchildren. I've been particularly concerned, I'm going to say over the last certainly decade, maybe even 2 decades, but certainly the last decade, where young people, children that are elementary school, middle school, high school, are spending their time indoors just exercising their thumbs, not doing what really needs to happen. I feel thankful my 2 grandchildren are outside. They're doing it. They're running, they're doing everything, kayaking, all kinds of stuff, which I absolutely love. And thank heavens they love doing it. But I've certainly spoken to other women that have said, I just can't motivate my kids or my grandkids to do anything but sit and watch the TV or play some game on their whatever device that they have. I picture these people as adults, particularly middle-aged adults, and worry that we're going to see this huge spike in heart disease and diabetes and hypertension because of this inactivity in their youth and maintaining that inactivity. Is there a way, do you think we can motivate young people to do the right thing for their own health? I don't think that young people see the long view. I don't think they can picture themselves at age 40 because they live kind of in the moment.
Sure.
But how do we get kids to be outside and on a ball team and such? I just feel like those things are getting lost.
That's a major challenge. And I think there's been a lot of psychologists and sports medicine people like me have looked into these issues. I think one thing that emerges from the literature is that parents, number one, have to set an example. So they have to do activities with the kids that are active as opposed to passive. Or if the parent is sitting around on their iPhone or iPad or on the computer doing TikTok, the children are going to emulate that behavior. The parents need to set an example. But I think where kids can also get an awful lot of activity is at school. And so I wouldn't discount the hour or 2 of recess, or whether it's organized or not, or after school programs that kids could be enrolled in. That's a great way to deal with inactivity, independent somewhat of the parents, as long as the parents make sure the kids are in, for example, the afternoon programs. But it is a challenge, and there's a growing trend, as you mentioned, of increased obesity and even worse, diabetes in children. So when it starts getting to that point, the parents really need to step in and deal with inactivity. I think there's some room for playtime and screen time, but when it gets excessive, that's a problem. I guess the only good thing is if they do a lot of TikToks, there'll be a lot of dancing going on. So that's one way to look at it.
Yeah, that's good. Are you more at risk for any heart-related health issues if you continue doing high-intensity workouts? Can you cut your risk?
It comes down to what is your health status at the time. In younger, healthier people who had any major diseases yet, they're less likely to encounter any issues with short bouts of high intensity exercise. We need to be a little bit more cautious in recommending that approach to exercise in people who have known disease. Although there have been some studies on high intensity exercise in people with disease, but keep in mind, in a study, people are very closely observed. They're screened very carefully. And so if there's any sign of heart disease or any other kind of problem, they either won't be in the study or they'll be taken out of the study. There's a strong bias in the research that's been done that has looked at high intensity individuals, but who are generally at low risk of any adverse event during exercise. It's the people who haven't been screened carefully, who have known problems, where I'd be more concerned and hesitant to recommend high intensity or vigorous exercise. Now, if someone has done moderate intensity exercise for several years, if they slowly creep up the work that they do, they work a little more intense, that's probably okay. But if they have any signs or symptoms such as shortness of breath or undue fatigue that just doesn't resolve after a little bit of rest, then they need to back off and perhaps even get cleared to do more vigorous exercise. So really, it depends on your health status.
You mentioned at the beginning of our conversation using weights and also resistant bands is what I think about. Do you have suggestions on how much weight, like 2 pound, 5 pound, 10 pound weights, and how long should someone use resistance using, for example, resistance bands?
The general rule of thumb is that you should use either a weight or a band during exercise when you can do 15 repetitions. So for example, if you're lifting a weight, you should be able to lift it 15 times where at the 15th rep, it's really getting hard. And repeat that twice. 15 reps of 2 sets of whatever exercise it is, either with bands or a weight machine, is the general rule of thumb to get health benefits out of weight lifting or resistance training.
I think some people may not know that they could actually go to Target or Walmart or another similar chain store and actually buy 2 pound, 5 pound, 10 pound weights. I think most people think you've got to get a gym membership in order to get those weights, and you absolutely don't. So
hand weights are pretty expensive. When I prescribe exercise to people, I might start them off at 5 pounds just based on my educated guess and say, can you do this 15 times? If it's too easy, then 5 pounds is not enough. So rather than tie down to a specific target, start at 5 pounds, but if 5 pounds is easy, then go on to something that gets you at the 15th lift. Now you're really starting to feel like 16 would be tough.
Many of our listeners are women. Quite a few of them are going to have been diagnosed already with osteopenia or osteoporosis. So they're frightened to move when actually moving is of benefit in bone building. Can you talk about that for a moment?
Absolutely. And that's kind of one of my areas of specialty, is to look at the effects of exercise on bone health. The best exercises for bone health are the resistance exercises because it puts stress on the bone, but that stress leads to a greater production of bone cells. There's a little bit of a breakdown, but the responses get stronger. And the other types of exercise that should be done for someone who has concerns about their bone mineral density, osteopenia or osteoporosis, are weight-bearing exercises like walking. Again, it puts stress on the bones in a way that the bones respond by improving the bone mineral density and the strength of the bone itself.
That's great. So I think that's going to inspire women to not avoid this in fear that they'll break something, but instead see that this is an effective method of bone building.
People who have severe osteoporosis can get a break, what we call a fragility fracture, even by sitting in a car and the car hits a bump. They can fracture a vertebrae. So again, if you have severe osteoporosis, I would talk with your healthcare provider about what precautions you need to take. But if it's mild, then things like walking and resistance training are the prescription for that.
You mentioned research a few minutes ago. Inform us about what types of research is being done in this particular area.
Things like Are there changes in bone mineral density and bone strength with resistance training versus walking versus an exercise like cycling, where you're not really carrying your weight? There's no impact on the bones. So we look at different types of activity to see what is best for bone health. Another area, though, concerning bone and avoiding fractures, and we just completed a large-scale study where I don't even have the results yet, but it was focused on improving strength, balance, and agility to help people not only try to increase their bone health, the tissue of the bone, but also prevent falls. Because most fractures occur with a fall, a non-traumatic fall. So, if you fall off a ladder, you're going to break a bone no matter how much exercise you do. But in people who don't exercise regularly and have some osteopenia, a fall is potentially very dangerous because it could cause a fracture. And so we've also done studies where we've helped people increase their balance, their flexibility, their agility, and their strength as strategies to reduce fractures and fall-related injuries.
That's really very helpful. Is there anything else you'd like to tell us regarding our heart health and the obvious value of exercise?
It's a critical behavior, I would say behavior or habit, that I think many more people need to adopt, because the benefits are what we call multifactorial. To get all the benefits from medicine, for example, you'd have to take about 20 pills to lower your blood pressure, lower your cholesterol, to improve your glucose metabolism, et cetera, et cetera, et cetera. Improve your bone health. Some of the medicines that are used in people with osteoporosis don't really work to put on new bone. They just prevent the turnover of bone. They prevent the loss of bone. But that bone that remains is often brittle. Whereas with exercise, the bone will get stronger. It has a different effect. So that if exercise was a pill, it would probably be equivalent to taking 20 pills in terms of its universal effect on so many body systems, including the heart and the muscles and metabolism, to prevent diabetes, et cetera. I often also talk about, you remember Flip Wilson?
Yes.
And he used to do crazy things, and he'd always used to say, well, what you see is what you get. Well, I think with exercise, you also get a lot of things that you don't see. What you get, you often don't see. So for example, the change in bone. I see it if I do a scan on you, but you don't see it. Or a person may get on the scale and see they really haven't lost a lot of weight. But with exercise, they're losing a lot of the internal fat, the abdominal fat, which is the less healthy fat. So it's a benefit that you get that you don't see.
That's a really good point.
And another area that I often talk about is a reduction in fat in the liver, which often leads to liver failure if it becomes too severe. And again, with exercise, you will lose liver fat, but it's a benefit that you don't even see. I see it in the laboratory because we measure these things, but you as an individual wouldn't see it, but it's a benefit that you get. So in addition to the things like that are easily measured, like how fast is your heart rate when you're resting, how out of breath do you get when you walk up a flight of steps, those are more obvious. But the benefits that I just mentioned are those that you get, but you don't really see.
So we should call this the hidden benefits of exercise.
That's exactly right.
That's amazing, really. Well, I want to thank you so much for joining us today. Dr. Stewart, you've taken the time to really educate us about something that a lot of people, I think, take for granted, which is getting out there and doing some walking and doing some basic exercising can be incredibly beneficial to our heart health. And that means that we're going to probably live longer, have more time with our family, more time with our children and our grandchildren and our girlfriends and our spouse. But we take it for granted that our body is always going to be okay. We need to take care of our body, otherwise it's not going to be okay. We hope you will join us next month for another educational and information and podcast featuring another Johns Hopkins medicine expert. And in the meantime, I invite you to visit the A Woman's Journey website at hopkinsmedicine.org/A Woman's Journey to sign up for a monthly e-letter, read about upcoming podcasts and programs, and to sign up for our upcoming complimentary Conversations That Matter webcast. Again, thank you so much, Dr. Stewart, for joining me today.
Thanks for having me.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lillie Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from HRH Foundation that supports our podcast series, Insights That Matter. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/awomansjourney. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/awomansjourney. Until next time, stay well.